Hello everyone, welcome to HALN's event on moving from plan to action. I'm just watching the numbers climb up, so we'll give people a couple of seconds to join because we've received around 150 registrants, so I just want to give people a chance to join. In the meantime, I'm going to start with some housekeeping. So please feel free to rename yourself in Zoom so that your organization and your name features. So you can do that either by clicking participants along the bottom of the screen, find your own name, click more and then rename, or you can click the three dots next to your little picture and your name. So everyone should be on mute, and we ask people to stay on mute just while other people are talking. But when you go into breakout rooms, etc., feel free to unmute yourself. If you are having any technical issues today, then please feel free to message Jahan from HALN in the chat. We will be using breakout rooms today, and we're also going to be using the chat function. So throughout the event, feel free to put any reflections or any questions in the chat. And for now, I'm going to invite you to all introduce yourselves in the chat. Feel free to say hi, where you're from, and why you're here today. So I'm just looking at the participant list. We've got about 50 people here today, so I think we can make a start on the content. So Jahan, if we could move to the agenda, that would be great. Thank you. So after this introduction, we're going to be moving into what we're calling fireside chats. So essentially a bit of an informal conversation between Julia Slay, an anchor expert who we work with at HALN, and Ollie Fletcher and Amrit, who have been through the learning set process. After this, we're going to crowdsource from the audience members, some top tips on moving from anchor planning to anchor work and implementation. After this, we're going to be showcasing 4 brand new HALN tools that are launching on the website today to help with this implementation work. Then we'll move into networking. So we'll give everyone an opportunity to go into 2 breakout rooms, chat, meet one another, reflect on the products. And finally, there'll be a chance for the audience to ask any questions of the panel. So before we move on, I'm just going to give a little bit of context. So the Health Anchors Learning Network has existed for over a year now, and we've been running events like this one. We've been developing learning tools, and we're currently in our 2nd round of running closed learning sets with our 4th group. So throughout this time, we've been crowdsourcing insights from anchors across the UK, but a lot of our work so far has focused on getting started. So developing that anchor mission, that plan, and that framework. In this session, what we want to do is dive more into implementation. So how to shift from planning and anchor work to putting it into action. So without further ado, I'm going to, if we could just stop screen sharing, hand over to Julia Slay, anchor expert who we work with at HALN, to introduce and chat to Ollie and Amrit.
Thank you, Sav, and really nice to introduce there. And it's wonderful to see some very familiar faces here. I've been facilitating the learning sets with HALN over the last 6 months or so, and both Ollie and Amrit were part of those first cohorts, and many of you have joined them too. So really lovely to see some familiar faces here, and looking forward to hearing about your practice, your top tips, and where you're at with this, which is the kind of hard work of implementation. It's often easy to kind of grasp onto the idea and much harder to try and put big ideas and ambitions into practice, and that's real focus of today. So we're going to have about 20 minutes or so hearing from 2 of our learning set participants about what they've been working on, what they've been putting into practice, and some of their learnings, and really excited to introduce Ollie and Amrit. I'll start, Amrit, I think I'm just waiting to see if your audio is with us, because I know we've been troubleshooting a wee bit this morning. So Ollie, I might start with you. Do you want to introduce yourself and give us the headlines of your role and what you've been up to in Somerset?
Thanks, Julia. So I'm Ollie Fletcher. I work for Somerset Integrated Care System, and that gives me the pleasure of being jointly employed by a local authority in the area. and also by the NHS. So through a very convoluted network of arrangements, I've got a tie to our largest NHS trust, which from next April is soon to be our only NHS trust in the system, to our county council, which from next April were due to be the only unitary authority across the whole system, and to our CCG as well, which from July will be the integrated care board. So we've got probably the simplest system in terms of organisational structure within the country, but there's also things that we've got which are weaknesses too. So for instance, we don't have a university. We've got quite a small population. We're one of the 3 smallest systems, along with Shropshire and Cornwall. We're rural, and we've got so quite a narrow economy in terms of the sectors that we engage in. So that means that for Somerset, we've got in the west of the county, 20% of the workforce work in health and social care. So anchor is really important to us. We're really important. And my role within that, employed by the integrated care system, is to cover education, so our typical learning and development things, both in how they look inwards to how we develop our own staff, but also how we look outwards. So how can we use that to target health inequalities, make sure that we're recruiting people in our local areas where social mobility is poor, or where there's multi-generational unemployment, rural areas where the traditional structures of working hours don't really work with the public transport available. And then also to look at economy. So how do we work with our local enterprise partnership on things such as digital inclusion, and also how do we work with Department for Work and Pension and large employers that might be making redundancies, partly to direct people into health and social care for kind of selfish reasons, for urgent workforce shortages, but also to see how we can develop people as an anchor employer, even if that means that they're going to be directing their careers elsewhere, outside of the NHS, outside of local authority, or outside of social care. So that's what I do.
Thanks, Ollie. And so interesting to hear about some of that context which has shaped the work you're doing. And, you know, some of those big factors like the other anchors that you may or may not have locally, the rural nature of it. I think all of that is, you know, key when anchors are starting out in terms of thinking about where they place their focus and what resources and assets they're working with. Amrit, can I see if we can bring you in by audio? I know the video might not be working, but let me just see if we can bring you off mute to introduce yourself. I'll give you a moment to try and do that.
Yeah, sure. Can you hear me?
Yes, we can.
Hopefully this is going to work, so apologies for the tech issues. Yeah, so my name's Amrit Rayat, and I am the Strategic Programmes and Health Inequalities Lead. Previous to this, I was working particularly around anchor organisations. My role, much like Ollie's, was across the CCG, the council, and working with our local trust that's Mid Yorkshire. And this was around sort of initiating some energy and seeing where the energy was for this work, where the ambition was, and seeing if we could sort of generate that, more of a sort of a bottom-up approach, going with that energy and seeing if we could sort of almost influence that strategy and that leadership into thinking of those next steps. And I suppose I was really lucky in that I'd started to work with a trust that was already signed up to, from a leadership perspective, the anchor principles or the anchor thought. So we already had what I would call anchor leaders in that system, which was really useful. So from Wakefield perspective, we're really geared up around that. But what I've caught from sort of what Ollie was saying, my role was similar in trying to widen now, connect what we're doing and connect that into our health and wellbeing strategy, so that health in all policies, diverging all that thought, that leadership out into the wider system. The place system is really where my role sits. So yeah, that's what I've been working with for the past, I would say, about 8 months now.
Fab, brilliant. And interesting that for both of you, one of the big areas of focus has been on bringing together different organisations within a system, not just working on anchors within a single trust or a CCG. And so really interested to pull out some of those reflections as we go through, because I imagine there'll be many participants here who are facing similar challenges. And both of you talked a little bit about your kind of early stages of the work being about kind of connecting across the organizations, galvanizing, you know, motivating, bringing people together around this. And I just wonder, you know, what did that look like in practical steps? What were you actually doing to try and bring the system together around this vision? Amrit, why don't you kick us off since you're off mute, and then Ollie, I'll come to you in a moment.
Yeah, sure. And I would say really connecting and networking with people lots of coffees and lots of cake where I could. I think that was the wonderful thing about that work, really just getting out there and getting a feel for what the understanding around anchor work was and seeing if they could understand that benefit, and really imparting some of my excitement, I suppose, around the work. And obviously the Anchors Learning Net was really supportive in that space for me as well, just taking some of that energy into those connections. So at the beginning it was all about really just talking and connecting with people and really seeing where the ambition was and if there was an appetite to go through this route. And your network really grows, and I can say in that first sort of few weeks the number of people I'd been in contact with and just doing different things, like not having a meeting at a desk but actually going around allotments and walking around allotments with the director of estates from mid Yorkshire. You know, why don't we not meet in an office, why don't we go for a walk? Not realizing I had the wrong footwear on, obviously, but they traced me all around Wakefield and those allotments, but doing that and inspiring that sort of excitement, because if they can see it, they can understand it. For me, that's what it looked like.
Brilliant. I love that, walking around the allotments. And you're right, it's a very place-based, you know, kind of tangible concept to try and get people to understand and get excited about. And they will get much more excited about seeing the buildings and the homes and the spaces, much more so necessarily than, you know, some facts and figures on a paper. I think that's wonderful. Ollie, how about you? What did the kind of first steps look like in practice?
I think the first steps for us were really generating a sense of urgency. So sadly, more Teams meetings rather than allotments and coffee and cake. But during the start of the pandemic, we had lower than average, and we still have lower than average unemployment. But we've got a lot of seasonal work, so that was really affected by the downturn in hospitality and in tourism, and also because we had quite a narrow profile. In the space of a couple of months, we had two large employers making between them over 1,000 redundancies, which, considering the population in Somerset is only about 500,000, was really quite terrifying in a short space of time. So it was working with unusual partners for the NHS and for people who work in adult social care, so with district councils, Department for Work and Pensions, with industry partners, with colleges as well, to make sure that we had the right in. So I spent a lot of time working with managers of factories, for instance, and seeing how we can redirect people from manufacturing jobs into things that cover health and social care. And sometimes that was successful and sometimes it wasn't, but much like Amrit, those broadened networks and those perhaps unusual networks as well, in terms of how we worked. We've got a partner which is called the 10 Parishes business area, which is centered on a small town called Wiveliscombe, which has got about 4,000 people in it, which is pretty typical actually for most of the towns in Somerset. And the hyper local, again, in terms of how those businesses work together, centered around that small market town, was really important to us too, because the way that things feel and the way that people value things in Wiveliscombe is different to other small towns in Somerset as well. So it's really important for us to understand where that large employer's primary base was and how we should interact with them on their terms and in their language.
Fab. Thank you, Ollie. And I wonder, you know, what challenges have been coming up along the way? You've kind of alluded to a few there, but have there been any really knotty issues which have come up that have kind of required some thinking, some partnerships, some kind of creative solutions? Ollie, do you want to carry on since you've got the mic, and then Amrit, I'll come to you in a moment.
I think there was some discomfort within some of the partners that, especially because despite our best efforts, the integrated care system really is viewed as quite an NHS-y thing, and district councils being like, why are the NHS getting involved in economic development here? That was something that we had to deal with, some reticence upon district council partners to believe that this wasn't just a flash in the pan kind of thing, and we were willing to engage over the longer term. So building the depth of those relationships as well as the breadth, I think that was some of the barriers, and also reaching the people who we were wanting to support into new careers and support into training. And some of the things that we did at first maybe didn't work. So we had a distance learning program which was designed to support people into social care roles. And one thing that we found later down the line is that because traditionally social care is really easy to apply for compared to the way that NHS jobs works, the support that we put into support people following redundancy into NHS jobs had disadvantaged social care, because no longer was social care for those people facing redundancy the easier option. So not only did you have the honour of the blue badge as it's seen, and the advantages of pay and terms and conditions within NHS, but it's also simpler to be supported by a job coach employed by an NHS trust to apply for an NHS job. So some of those things that we've tried to do to put in support has accidentally disadvantaged other parts of our system, which is disappointing. But overall, the number of people that we're seeing being supported from precarious work and from lower income work into things that are more stable and with better progression has been positive, but it's not been wholly positive. So managing that tension as well of how do we make sure that we're not disadvantaging one part of the health and social care system over another when we're engaging in this anchor work, that's been a challenge as well.
And you mentioned there something that I think may be resonant for many people, which is the engaging on economic development, and perhaps sometimes it's for the first time or more explicitly framed around economic development, which is obviously a core part of what it means to be an anchor and to be a health anchor. And I'm just curious, with the district councils you've been working with, what kind of colleagues have you been working with? Is it the economic development departments? Is it others? Yeah, what's that? Who have you been linking in with there?
Economic development broadly. So in Somerset split into 4 parts, and in South Somerset we fed patient flow data into their town deal and redevelopment. We've been working with Sedgemoor along the Somerset coast on the redevelopment of major real estate into new purposes, and we've been working in Taunton on employment hub development, how we can target people really locally within some of our most deprived housing estates as well. So housing somewhat, but mainly with economic development, but both in terms of really hyper-local and working with architects and those sorts of things, which have been quite exciting, but also in terms of working with some of those people that perhaps work on the more theoretical side of macroeconomic development.
Brilliant. What a mix. How about you, Amrit? What are some of the kind of challenges and maybe things that didn't work that have come your way too?
Yeah, and I think really if I can think of sort of one around that, it's capability in the time that we've just come through. And I'm talking to lots of people that really resonated, from whether it was collating the data, getting the right data into the trust's steering groups. There was a lot of pressure on a lot of people at that time as well, and I think that was one of the bigger issues. The political, I was listening to what Ollie was saying, the political sign up, I think was a mixed bag really from sort of the council, in that there were lots of community hubs and community anchors that were set up, and there was something around, and I suppose an element of around working to trust each other in that space, that one coming in or another public sector organisation coming in isn't going to destabilise something that's already in the community, quite hyper-local, very connected to the citizens. It's not going to destabilise that work or take away from. So there's something absolutely around bringing that trust into the fore, and for all to understand all the sort of guiding principles, I suppose, in a way. I think the other thing is language. Having that common language and that common understanding goes hand in hand with the trust issue. You wouldn't want another organisation or a voluntary sector organisation thinking or feeling that contracts would not come their way, or no more sort of work, and that wouldn't come their way, because I think that was really important. So I've done a lot of work sitting and listening to those really important voluntary sector organisations and learning from them, and getting to build that trust between, and sort of saying, if you led in this, absolutely right, but we need to learn more of the system. So connecting the system to itself, I think, was really important. And I think a novel way of me trying to bridge that gap was just getting out and seeing people actually, and having those really open, trusting conversations. Sorry, I don't know if I've lost everyone.
No, we can hear you. You've frozen, but we can hear you. So keep going if you wanted to carry on with that train of thought.
Yeah, so I think it's the language, and definitely the capacity at the issue, especially in my work with the trust as well. Connecting sort of
I think you might be cutting out a bit now, Amrit. I'm gonna come back to you, Ollie, and then come back to you in a couple of minutes, Amrit, hopefully once the connection has strengthened. Oh no, you're back with us now. I can see you. Did you want to finish off that sentence? No, and actually I think we've lost audio, although we can see you clearly, but maybe try and mute and unmute again, and we'll see if some live troubleshooting. There we go. Okay. Well, the next bit I was going to take us on to was thinking a little bit about, given that we're really placing the emphasis today on practical action application, doing this work, what does it look like, and getting into some of the nitty-gritty. I was keen to hear from both of you about what the rest of the year looks like, and perhaps into 2023. So what are the kind of big things on your agenda? What are the key decisions or activities or actions that you'd love to be landing locally? Is there a kind of delivery plan you're working to, or what's the kind of what's on your radar really in terms of taking this forward even further? And Ollie, I might start with you and then come back to you in a couple of minutes, Amrit.
Sure. So when we started the work, it was very much response to individual instances of redundancy, and then also individual instances of underemployment as well, especially in rural communities and coastal communities. And what we've now developed is something called the Talent Hub, and that brings together various different ways to support underemployment, including through the Restart scheme, which supports by Department for Work and Pensions, through sector-based work academies as a redundancy offer, through a presence in employment hubs, for instance, and also through boot camps, again, as something centrally government funded. So what we want to do within that talent hub is stabilize our workforce a bit. So because we've been working on, in some cases, 6 months worth of funding, we've had sort of quite a high turnover in terms of some of the trainers and job coaches who work within that team. So stabilizing the workforce, I think, is really important, and also embedding our presence across the county, because at the moment in the south of the county, where employment hubs in local communities were set up first, we've got more of a permanent presence, which gives us more of a link to our housing associations and more of a link to those district councils and to community groups as well. We want to expand that, so we've got more even coverage across the county. When we've looked at our data, we have got more people coming from the 3 major towns in Somerset than we do from Mendip. So West Somerset is hyper rural, it's based around the Exmoor National Park, and then we've got the Mendips and the West Mendip area again, basically a bunch of hills more than anything, and we've got per population really low uptake in the sort of offers that we're supporting, even when you look at more affluent urban areas or less affluent urban areas. So I think having an even coverage across the system, and also stabilising our workforce, because where we've gone from generating a sense of urgency around a single issue to trying to have a more permanent offer so that it can be advertised by housing associations, Department for Work and Pensions, Job Centre Plus and the like, and charities as well. And also offering it as a social prescribing offer through our GP practices too. Having a stable offer is really important, so that we know that what people are saying that we deliver is something that we're delivering. So I think that's the most important thing for us in the next 12 months.
Thank you, Ollie. Fab. And Amrit, I'm going to invite you in now. Thank you for bearing with us despite all the tech challenges. I know it's deeply frustrating when tech doesn't go your way. I really appreciate it. So yeah, any thoughts you want to share on kind of what's on your radar over the next 6 to 9 months, the big things you really want to push forward, big kind of practical activities and actions?
Yeah, absolutely. I think some of it for my role as it's evolved now is sort of keeping an eye on the space within our local trust around what's happening, connecting that in with the conversation. We have undertaken sort of a review on the Leeds progression framework, so that work's really progressing really well with having created that energy within those particular organisations. And I think within my role, really looking to the health and well-being strategy that's just been refreshed, and making sure that we start to have sight on all of our programs of work really, and start to align those into what we want for our district as a whole. Really aligning that with the initiatives that we've got going on with the Core 20+5 as well, and really starting to bridge those gaps between the health and social care, I think, is really what's happening. We've had a couple of visioning events that have been hosted by both health and sort of social care by the council. That's been led by the council, and really looking at the spaces and opportunities, creating that common narrative, I think, is really important. So we're at the beginnings of having something which is more akin to sort of a movement, and really creating a bit of an ecosystem involving our colleges, further education within Wakefield, Chamber of Commerce, and I think that's really helpful, and we can learn lots more. So we can learn sort of from the police and the fire within those services, and what we found is that historically they've not had that much airtime on places like Health and Wellbeing Board, but the initiatives that they understand and carry, I think, and they undertake, and the connectivity that they've got to our citizens is really important. So it's about harnessing and understanding more of what we need to grow with some of our hyper-local approaches as well.
Fab. Oh, it sounds like there's lots to do and lots of exciting stuff coming up in both of your areas. So really look forward to hearing where you take that and where you get to. I'm going to, Sab, hand back to you at this point to segue us into the next part of the agenda.
Great, thank you, Julia, and thank you so much, Ollie and Amrit as well. That was so interesting. And so both Ollie and Amrit have been through the Learning Set process. And in those learning set sessions, we have heard lots from the participants about the barriers of putting those anchor missions, plans, frameworks into action, and how overwhelming it can be to get started. So we thought that this would be a really good opportunity to kind of crowdsource from all of you, from the audience, on your top tip for implementing anchor action. So I'm going to ask everyone in the chat to please share one top tip for other people on this journey of moving from plan to action as a health anchor. Yeah, so it'd be really fantastic if you can post it in the chat for everyone to see. So while you're thinking about that and posting your top tips in the chat, I'm going to just go back to the panel and ask each one of you in turn for a top tip that you have on moving from strategy and planning to action and mobilization. So just put your top tips in the chat, and I'm going to move first to Julia, if that's okay. What's your top tip?
Thanks, Sav. Well, I think something that came out loud and clear to me in the learning sets from a number of participants, which was a kind of new insight that I hadn't gained before in some of my previous work, was around how many of the learning set participants were really being led by the data in their system about either where there was a really strong need for action as an anchor or where there was a massive opportunity. So there were some really compelling examples of people who gathered powerful data on workforce, for example, the kind of stuff that Ollie's been talking about, or labour market inequalities and how that could match with upcoming infrastructure investment projects. So, and that data had really helped them to create a sense of urgency and persuade leaders to come on board. So I would probably say trying to get your head around some of the data that might help you identify some of the opportunities is a helpful place to start.
Yeah, I think data is a really important one. Thank you, Julia. Amrit, I'm going to come to you next. I can see you're off mute.
Thank you. I would say, and I came off mute because I don't want to lose connectivity, so while I've got it, I'll talk. I think for me, it really goes with, built on what Julia's saying, and while the data's absolutely there, and we've chopped and changed the data, looking at sort of areas of deprivation and overlaying that with workforce data and where that workforce comes from, and doing some good work around that. I would say creating memorable moments or memorable opportunities, and that's really using that lived experience, which I just think is just so powerful. The lived experiences we've heard at our board development sessions in the trust have stayed, and they have created a catalyst from within people, and that's why I sort of think about anchor leaders. We've got anchor organisations, anchor work going on, but really leaders who are really anchoring in where they stand and moving that forward. So creating those memorable opportunities, I think, is really important from my point.
Fabulous. Thank you so much, Amrit. That's really interesting. Ollie.
I think the data one's a really good point, Julia. One of my pet peeves is how difficult it is to get comorbidities data in the same place as indices of multiple indices deprivation data. So that's one thing I'd love to see. I don't think we're going to achieve that next year locally, but being able to say, okay, we've got multi-generational unemployment here and we've got COPD as a high instance here, I think that would be really interesting. The tip that I'd say is to get the right people in the right places. So one thing that we've managed to do is our head of service for our talent hub, she sits on the local enterprise partnerships skills panel, and she's the first person in health, so it's regional, it's across 4 different local authority areas. There's probably 10 or 12 different NHS trusts which are involved in the LEP footprint, and having that as the sole health voice, it shows kind of you can get a bit of ahead of the curve in that. And there's other places with Department for Work and Pensions, like I said when I was talking with Julia about feeding into redevelopment plans in local areas as well. So get your voice in what might be traditionally seen as the wrong place, and make sure it's consistent as well. Not just I'm going to this one meeting, but how can you get yourself a member of whatever board that might be with the right leader, so that you've got that consistent voice so you can build on something. I'd say that would be my top tip.
Fabulous, consistent voice. Thank you so much, Ollie. And there's been absolutely fantastic ones in the chat. I don't know if everyone's been reading that, but I would definitely recommend taking a look. And actually, we've got a few minutes, so if possible, I wouldn't mind bringing in 1 or 2 of our audience members. Naomi, I don't know if you are able to unmute and come onto video, but you've put some really great things in the chat there. So I wondered if you wanted to speak.
I'm afraid I'm not going to come onto video because I'm still full of COVID.
No worries.
I'm quite happy to have a chat. Yes, no, hang on, bear with me just a second.
Yeah, sorry, I didn't give you much notice there, but you just put such great things in the
Just
chat.
closing an office door, apologies.
No worries.
No, I'm a sustainability manager in the NHS. So for us, it is hugely about finding and building networks and teams. So quite a lot of the anchor work that the NHS is doing is actually about making connections with education and local authorities. And, you know, at the end of the day, quite a lot of the time, if we can do commingled either events or buildings even, it actually serves everybody better, because somebody coming to visit an NHS clinic can also be doing something about their rent and their, do you know what I mean? Can actually kind of bring everything together all in one place. So for me, kind of co-use of sites is really important, but also finding and building your network. So it's actually for me about, there are many, many people out there who I personally think are absolutely begging for just to have some direction, and then they'll run with it. And so there are many, many, especially third sector and charity groups that we're now getting involved with, who just want somebody to say, this is the direction you can go in, and they're off and running. So yes, for me, it's about find the tribe, and then work from there.
Find the tribe and work from there. Great, thank you so much, Naomi. I thought I could maybe have time to bring in 1 more person. I think Matthew Hopkins wrote something in the chat about don't wait for perfect, just get started, something like that. And if you are able to, Matthew, I wondered if you'd be able to take yourself off mute and speak about your experience of that. Perhaps Matthew is not able to come off mute. Oh, doesn't have a mic. No worries. Well, thank you anyway, Matthew. So we've got a couple of questions in the chat as well, and what we'll do is we'll come back to these in the Q&A and at the end of the session. So do please keep your questions coming. Just before we move into showcasing some products and tools, I have time to bring in 1 more person. So Peter, you've just put share your stories, tell it as it is, avoid getting caught up in or isolating others through use of specialist language in the chat, which I think is really, really important point about jargon. And I wondered if you wanted to come off mute and speak to that at all.
Just very simply, thank you for the opportunity, that there is, I think, a risk that this becomes something a bit over there as opposed to part and parcel of what we are in and about already, and hence the comment about the language and so forth, not to mystify it, but to do the reverse. And sometimes language can be helpful in certain situations, but I'm slightly concerned that we might be isolating and people going, oh, I'm not ready for that, or that sounds very complex and we wouldn't have the time or resource to commit to that. Whereas actually, they can and they would, and they need just a wee bit of a light encouragement. So how do we do that in a more friendly enthusiasm, as opposed to making it sound a little bit techie or complex when the principles are actually not, in my view?
Yeah, thank you so much, Peter, for coming in. I think there's a really important kind of broad point about language and anchors and the scope of language, the scope of the word anchors and all of this work, and whether sometimes the language is useful or sometimes it's alienating, but maybe not a conversation for right now. So I'm going to just hand over in a second to my colleague Jahan, because we have a HALN web page, and on there we've got a tools page. And throughout the past year, we've been uploading some tools, often around getting started. We've got one on anchor frameworks. We've got some on working with partners, such as housing associations. And today we're launching 4 new tools, which I'm just going to hand over to Jahan to speak about. And I'll drop the links in the chat as she goes, so you can all download them yourselves.
Thank you so much, Sav, and how wonderful to be part of this conversation. It's been a really inspiring start so far. Loved hearing all of those suggestions in the chat around top tips. So just give me a thumbs up, Sav. Can you all see my screen okay? Fantastic. So I have the really exciting job of taking you through the new tools we're releasing today. So just before we get to those new tools, I wanted to quickly flash up on the screen our tools page. And Sav's going to pop into the chat a link to that in just a minute. And we already have loads of tools on there, so I thought that would be a great place for us to start. Many of those tools are focused on getting started with your anchor activities. So what you can see at the moment is just a snapshot of them. We do have a getting started tool. It's designed to demystify the first steps in your anchor journey. I definitely recommend having a look at that. And we have another one, which is a one-page guide to creating your anchor framework or charter. We do also have some summaries on events that we've run in the past and specific topics. So you'll see on the screen now, we've got top tips for anchor action from our Anchors in a Storm event, which happened this time last year. And we also have one about the unique role of ICSs. I did notice a few people in the chat mentioning that already. So that would be really useful for some of you to go and have a look at immediately. We also have a blog section, so if you're looking for a specific anchor topic, definitely check that out. So not going to keep you in suspense any longer. Let's talk about those new tools. We're releasing 4 of them today, and they are all focused on moving you from plan to action as an anchor. So the first one, 5 questions for initiating anchor action. So you should be able to see that on your screen now. Some of you might have gone over to the website already. The tool is there and ready for you to download at the moment. So if you want to go in and have a look on your own screen, that's absolutely fine. I'm just going to give you a quick rundown of what's included in this tool. So we're looking at how you can initiate anchor action, and the information in this tool was actually crowdsourced from our Learning Set participants. And we've already mentioned that quite a few of you on the call, Ollie and Amrit, were both part of that. And those Learning Set participants are your anchor colleagues, and they have already begun their anchor action. So some really useful information in there. So the purpose of this document, of this tool, is to support you in embarking on those early activities and moving out of that planning stage. And some of the highlights are thinking about what's already happening locally. So we've had a load of comments about that in the chat. And Ollie and Amrit have both mentioned that. What is happening? What are the other projects or work that's done by other anchors in your area? How does it align with your mission? How do you connect with others? We heard about Amrit going for walks and meeting people, getting out there and speaking to them. And then the last bit here is thinking about the gaps. Where are there gaps in what's happening locally? The tool also has a quick look at who is part of the organization and what really matters to them. Now, I saw that coming up really heavily in the top tips because it's such a great point. It's a really great starting point. Understanding who your workforce is and incorporating their perspectives, as well as identifying who those early anchor champions are going to be in your organization. That can be a huge push to get your anchor agenda going right at the beginning. So that's our first tool. I'm going to move on to the next one. And the next one is focused around this question of what does it mean to lead an anchor mission effectively? Now, it's a big question. We've broken it down into some key building blocks of anchor leadership here. So what you can see on the screen is 4 of them. And they kind of focus on these very high level skills and attributes which are core to leading an anchor mission. So the first one you can see all the way over on the left is about consciously adopting an anchor mission. That's about being intentional. So creating clarity about your intended benefits and outcomes and how that leads to getting buy-in from senior stakeholders. I heard that come up a lot in the first section and when we were talking at the beginning, because it is so important. And that also links to how you give permission to staff members to invest their time in anchor work. How do you really get this off the ground from the beginning? There's a second point here around system change, about system leadership. This is really about enabling change across the whole system with shared goals that might be. So that might look like charters, that might look like ICS level work or collaboration with partners who are further on in their anchor journey. And then on this document, there's also quite a heavy focus on changing culture at every level in the organization. So that looks like strong communication of the anchor mindset, and it might also be supporting employees across the whole organization to embed that anchor mission in their job where it's possible. We have spoken a bit about that already, and I'm going to come back to that again in a second because we have a whole tool focused on that. So our third tool, this one is about governance and delivery structures. So we're deviating a bit here from speaking about the people aspect of having your anchor mission and getting to anchor action. This is really about giving your anchor mission some structure. How do you structure it as you move ahead? So the tool provides some clear guidelines and also some examples. I'll show you that in a minute, on how the correct governance and structure can actually enable that anchor action. So there's 5 key questions on this tool. And the first one really is about, when do you implement structure? It's a great starting point because it does help you consider if you've already built a movement around the existing staff members who are passionate, or maybe whether you've got the correct buy-in from senior leadership and the right sponsorship of your anchor work in order to actually get that structure which will help you. So helping you to think about that up front, really. And then it also gives you a view of how to create the right structure for your anchor program. So you'll see on the tool, it talks a bit about understanding where the program is positioned within the organization and how the results from the program are reported, being 2 really key features of how you create structure around the program. And then lastly, who needs to be involved? So highlighting those dedicated anchor program posts. There might be many of you on the call who are in those dedicated posts, but also looking at other team members who are responsible for elements of anchor activity or whose work might form part of the anchor program, but they're not in dedicated posts. And then lastly, thinking about those who might not be directly involved, but do have a stake in the anchor program. Might be local population served or colleagues with an interest in the program. How do you bring them in, and what's the structure around that to making sure they are consistently involved? So this tool builds a picture of the best governance and delivery structure for your organization and your specific anchor agenda. I'm just going to click ahead because there's a second page on the tool, which actually includes 2 examples from our friends over at Mid and South Essex NHS Foundation Trust and the Northern Care Alliance as inspiration, talking you through how they've structured their anchor programs and what their governance looks like. And then lastly, we have a tool that digs into the concept of engaging your workforce in the implementation of your anchor agenda in a bit more detail. So we've touched on this topic a few times. It is really key, but how do you do that? That's what this tool covers. So there's a few key themes in here. asking some key questions. Firstly, how can you build staff awareness and your anchor mindset in your organisation? And again, a very similar point to what people have said already about tapping into employees' passions. Now, in our learning sets, I know Ollie and Amrit and Julia spoke about this at the beginning. I was really surprised to hear about the interests and passions that were uncovered when you asked this question in your organisation. You know, finding out what people are doing with their weekends, what do they really care about, what are they bringing into their work that is really important to them. So asking that question. Next, how do you model good practice through practical support? We've heard examples of things like cycling to work schemes, meeting caring responsibilities, making healthy food choices easier in the workplace. How do you make it easier for people to get into that good practice? The third one here is recruiting differently as part of your anchor agenda, so targeting local recruitment. And then lastly, how do you tackle inequalities in your existing workforce? Now, we spoke right at the end of that fireside chat about data, and that is really key here. But there's also an element of, once you know what's happening, how do you create some kind of structure that might help employees move through the organisation where they might see some inequalities? So this might be structured progression routes for employees. This might be creating a culture of knowledge sharing and progression. There's a few examples in here, but really looking at how you can tackle those inequalities in your existing workforce. I'm just going to pause there because I've spoken quite a lot. Sav, have we got the link in the chat? So are people able to access that?
Yes, they are. They should be.
Fantastic. That's good. Now, I have spoken loads, so we're going to get you guys to have a little chat now. So the next activity is actually going to be sending you into breakout rooms, where we want you to have an opportunity to network with each other. There is so much knowledge. I mean, I've seen that in the chat. I know you have, and everyone in this call has a huge amount of information as to how they're doing this in their organization. So we want to give you the opportunity to speak to each other. In just a second, Sav is going to pop you into breakout rooms, and you will have the opportunity to introduce yourselves to each other, share emails and contacts. And what we want you to discuss is what's landed with you so far. What have you heard that's been a kind of golden nugget that you're going to take away with you? And where have you noticed that there might be challenges that you're facing on the topics that we've discussed so far?
So if everyone can start dropping their reflections into the chat, that'd be fantastic. And I'm just going to move to the panelists. So Julia, Ollie and Amrit, if you can be ready. There was a question in the chat a little bit earlier, so we'll just start with that one, which was, how long does it take to get from planning to delivery? So Ollie, I can see you on my screen and I will start with you.
I think that to get from planning to delivery, for us, we probably did it upside down. So we didn't develop a strategy first. What we did was we were faced with a large number of redundancies, and then quite quickly we moved to deploying an offer. So we did that in a number of weeks. Between one monthly meeting and the next, we already had an offer and we had people going out into the factory in question. And that meant sometimes our offer was wrong, so I wouldn't necessarily say that's the best way to do it. The three things that we offered to that factory were a guaranteed interview scheme, which did have pretty good uptake, a sector-based work academy program, which now we're running across the county every 3 weeks, so it was great to start, and then a distance learning program, which only had 5 people out of 836 people who work in that factory going on. So there were some things that definitely missed the mark, but I think that for us it was about harnessing that sense of urgency. So if you've got a sense of urgency, if you've got an action you can do, commit to that action quickly, enact it, and just accept that you're not going to get everything right, but adopt from that what can be stabilized.
Fabulous, thank you, Ollie. Julia, I'm going to come to you next. How long did it take to move from planning to delivery?
Yeah, I mean, I kind of agree that I'm not sure that planning always happens first. I sometimes think that the thing that kickstarts the planning is the really important delivery work of engagement. A lot of what Amrit and Ollie have been talking about this morning, the kind of conversations, the identifying existing practice. And also there was a comment, I think, from someone in the chat earlier, you know, we can't wait for the perfect plan. And I think that's definitely true in Anchor's work. It is a lot of learning through doing, testing. There's a lot of existing practice happening. I think usually at some stage in the first 6 to 12 months, a lot of anchors have found it helpful to develop a plan. But I think that plan often emerges from the engagement that's happening across a system and reflects a lot of existing activities and then tries to set some priorities. So I think they are a little bit more in tandem than they might be when we're thinking about strategies and plans in other areas. That's my 2 cents worth.
Thank you, Julia. Amrit, have we still got you? I think Amrit might be frozen. Is she frozen for you two as well?
Yes, I think so. I thought, yeah, she's coming in now though, I think.
Yeah, sorry, was that question for me? I missed quite a bit of that. I think really, again, putting a timescale on it's really difficult, but I think if so if you start to scratch below that surface, you can actually realize very quickly that anchor work is already happening, the energy is already there, and it's then when individuals start to overlay the programs and strategies. But it certainly came up in our breakout group around as well when they started to have those conversations. The work's already happening, but I think the point is if
I think we've lost Amrit's sound there. Amrit, if you can hear this, do feel free to put the rest of your sentence in the chat. But I think we might move on just because, yeah, I think your tech has gone down. So what I might do now is I might open the floor. So if anyone has any other questions, I welcome you to take yourself off mute and ask the panel any questions or reflect verbally on anything that stood out for you in this session so far about shifting from plan to action.
And if anyone was going to reflect back from the breakout rooms, it might be interesting to hear a little bit more about those conversations too.
Melanie, I can see you on my screen, and although that might be unfair, I wondered if you are able to maybe feedback from your breakout room and share anything that you want to reflect on.
Sure, thanks, Savannah. I actually took some notes, so I'll just read those to you.
Great.
That will be easier. In our group, we had myself and Aruj, both of us come from primary care. So that's general practice in Southwest London. And we also had Jill, who works for a company called Helpforce, who do support mainly trusts to increase their volunteering offer. We had Hannah, who is running the Mayor's Academy in Northeast London, very new, early days on that piece of work. And then we had Wayne from Darlington, who is Darlington Foundation Trust, interested in the health inequalities aspect. So we had a useful discussion. Everyone pretty much agreed that that everything is connected to each other. At one point, Jill actually mentioned about perhaps a map, you know, a map of an area. We all know our geography that we're talking about, but perhaps being able to pull together the organizations that are involved. I mentioned the thing about, we know that saying about the map is not the territory, because that made me think of that. You might have your map and your geography, but actually how it all works and how things are connected, who talks to who, if they even talk to each other. And we're talking about fire, police, universities, employers, quite a broad range of organizations. So Aruj mentioned we need to do something perhaps around the limited communication. We spoke about the language and a lot about jobs. So all of us in our group had something to do with jobs and inequalities. So so that was a key thing. One of the useful things I pulled out from the chat was about it. There's a risk it becomes a speciality. Again, it's about the language that we use, but really goes back to what Matthew was saying earlier on. It's everybody's business. It's part of working processes and systems. simple language. We're doing it already, not making a big deal of it. And what we need to try and do is find common goals, common objectives and ambitions, some sort of shared identity, which might be the charter, and work towards that. Thanks, Savannah.
Fabulous, thank you so much, and without any warning. We've just got another question come in that I thought would be good to field to the three panelists. So I think Amrit's trying to join, but we'll start with Ollie and then Julia. The term anchor organisation can be quite segregating. How do we determine who gets a voice at the table when devising programmes, as for some anchor organisations might not be your typical organisation? So it's about whether that word organisation is segregating. Ollie, what do you think?
I remember when we were doing the learning sets, and I was speaking to somebody from Scotland, and they were talking about the role that the water played in as an organisation, and obviously it's part of the public sector up there. Whereas down in England, it's a network of private organisations, and we never work with our water providers. And I think that that's really something that resonates with me from that point. The organisation for us has often, possibly wrongly, come to mean not necessarily public sector, but public service provider. And for what we've got 4 statutory organisations in our county, they're always present. And then we tend to have a representative of GPs, which across 65 GPs in the practice in the county, 75% of whom aren't part of a larger organisation. That is a real problem. So I think there's an element of realism, that you're never going to have all of those people in the room. There's also an element of localism. So if you target to Chard as a small town in Somerset, and we know that there is 5 GP practices in that town, there's 1 high school in that town, there's 1 district council partner, we know who the main connector is in terms of social prescribing. We can bring those sorts of people together and bring in the appropriate housing associations, that sort of thing. So I'd say that you're right that anchor institutions tend to suggest something that means inadvertently you're halfway down the path thinking the wrong way, perhaps. But if you can act pretty hyper-local, then I think you can overcome that by understanding some of those, that territory, that terrain, rather than what the map says, as Melanie pointed out.
Great, thanks, Holly. Julia, do you have anything to add there?
I mean, I completely agree. I think that it really depends on where you are. I mean, also, Ollie, as you were talking earlier, you know, in your opening remarks about Somerset and some of the anchors you have there, and you don't have a university. I think we often think about universities, local authorities, health providers, and sometimes housing associations. I think there's some really interesting work going on in arts and culture around the idea of arts as a civic institution, as an anchor institution, and they don't always have the same scale in terms of workforce, but they will often have really deep community links. Sometimes they'll be doing really interesting infrastructure projects and creating new spaces. I think that they're really interesting partners in some places. And yeah, kind of utilities companies, other businesses or providers locally, I think can be really brilliant allies to have, and are not necessarily the types of organisations who are already around the table of, within the integrated care system. So I think it is helpful to really think quite broadly about who's operating in your area and what you might have in common with them. And I think people in the learning sets have always come up with some fascinating partners that they've been working with. So yeah, definitely worth keeping an open mind about who might be worth talking to and finding common cause with.
Yeah, I think that's a really important point. Thank you so much, Julia. Amrit, I'm just going to come to you. I don't know if you were there when the question was asked, but it's about whether the term anchor organisation is quite segregating, because some anchor organisations may not be your typical organisation.
Yeah, thank you. And I think it can be, and that's the point I was making around the language and the trust issue. So it can be segregating for a few more reasons in my experience, in that there's a bit of
sort of a clash, I suppose, in energy or ambition, and one feels the other may take away if other organisations come on board. And it may be my viewpoint is just to let that work happen, I suppose. We've been working with lots of anchor organisations, and it may not have all 6 pillars or guiding principles in there, but they are an asset. So in Wakefield currently, we're embarking on what we're calling the big conversation in Wakefield, which is exactly what it says on the tin, a conversation with our citizens, with our people, about what makes Wakefield a great place to live, work and grow. And through that journey, we've absolutely connected with the arts and culture community as well, and the assets that bring, and the determinants of health and the impact that can have on health inequalities, and really using those, really opening up people's sight, I suppose, opening that up to actually there can be other organisations that in this that can support us, and trying to create a culture where actually we can only do this in collaboration. And I think that's the big issue, isn't it, here? When you talk to other community anchors or other organisations, for example, the Chamber of Commerce that I've said, you know, they already have those ideas embedded. What they don't have is the capacity necessarily, or the HR function internally within those small SME organisations. So thinking about things differently, about who can offer what, I think is really helpful. But adding all players and just opening up a conversation sometimes can highlight things that you perhaps didn't realise or know.
Great, thank you. And I think there's a lot of agreement in the chat. I saw some people talking about the importance of getting the private sector around the table. So yeah, the three of you kind of really, your answers really chime together on that one. Just before we move to the evaluation and close, I'm just going to ask one last question, which Kathleen popped in the chat, which is about ownership. In the NHS, who has ownership? Who is it who leads the plan? Julia, can I come to you first?
Well, I think the idea is that we need it to be shared, really, and particularly, I mean, I think it was really Amrit and Ollie's presentations this morning, I think, just go to show how much is happening at a system level at the moment. And there are an increasing number of spaces where system leaders come together. And I think that is where we need to see joint ownership, because one of the things that's become really clear is that many anchors will have a common footprint and common interests across a geography. And it definitely makes sense to be having these conversations together, if not, you know, taking action together. I mean, I think it'd be interesting to hear from Ollie and Amrit, who locally have they seen, you know, really leading and spearheading this work. I think it does vary from area to area. I don't think that the kind of owner or the champion or the sponsor is always the same. I think it really depends on where you are and who's got an interest and whose portfolio aligns with it. So I think it possibly is also quite varied in terms of senior sponsorship and leadership. Yeah.
I think there's definitely agreement. I saw a lot of nods, and Melanie in the chat said that it's about give and take. So Amrit, can I come to you, and then we'll finish on you, Ollie?
Yeah, sure. And I think it really made me smile, because who owns this? And I think about actually the staff as well. In some instances, they absolutely own and harness that energy. I mean, you know, the ambition, just when you speak to those people, perhaps when you're on the ward and you just hear them with the passion that they talk, they're absolutely owning that piece of work, you know, and it's creating that energy, and they're getting people involved, and they're talking about that outside of their workplace as well. So there's that pride that comes with it. I think definitely sort of from a sort of strategic perspective, it has to be owned collaboratively. It really does, for the energy to really drive. Now in Wakefield, individually, my journey started off talking to individual trusts, which I think at that point was really important to get to understand where they were, what the ambition was. But I think as that's grown and we're focusing on sort of with the legal landscape now changing in CCG world, we're absolutely focusing on a system, a place-based system level around who owns that. And the work that we've done around our visioning events for the future, around this big conversation that we're having, is it does need to be co-owned, because there's energy in that, there's mileage in that, just to progress, because these things can happen at speed, I suppose, and there's a danger. Either you could go down, it could be a trial and error, but you know, that steam runs out, or people are just not signed up to something that's so vast.
Thank you so much, Amrit. Ollie, I'm just going to come to you last.
I think that on the ground, it's definitely our job coaches. So those are the people that change individuals' perceptions of themselves so that they can then be successful in roles. And for us, it's very much not about just getting somebody to have an entry role. It's also about developing people as well so that they can move up through the band structure in the NHS or move out into whatever sector they might want to. So that has been really important to us. And then one success breeds another success. More managers talk to each other and say, actually, this is a really good way to recruit people. Not only is it the right thing to do, but it solves the problems that we've got in terms of immediate workforce. I think that the collaboration point that Amrit had was true. So we've got a people board, which is made up of local authority, NHS, care providers, regional Health Education England and NHS England teams, and the voluntary sector as well involved in that. And that's who it's theoretically responsible to. And then when you're looking from the 1st of July and the Integrated Care Board coming into being, the finance director, not the HR director, despite it being the people board, but the finance director is going to be responsible for anchor work. So for greener NHS, for procurement, for economic development, and also for the sort of work that we've been doing as well. So I think there's going to be a figurehead coming in. That person's not yet been come into post, so that's going to be really interesting to see how we interact with that, and the fact that they're an NHS person, I think, as well, is going to be interesting. But there's an official answer there for you, but I really think it's the job coaches, because without the job coaches it wouldn't have happened. However slick we can make the process for something to work, if it doesn't feel real and you don't convince those candidates that previously wouldn't have even applied for those jobs but have written themselves off for those opportunities to then be thriving in those roles and seeking progression, I think that's the real owners in the NHS.
Thank you so much. A real mix of answers there. Some about sharing ownership to keep that kind of energy and steam shared amongst people, and some about the importance of a figurehead in a job role. Jahan, I'm just going to ask if you can share the last slide. And for everyone still here, thank you so much for giving us 90 minutes of your time. I'm just going to ask you now to quickly fill in this poll, because we'd really like to know how you found this session. So on your screen right now, if Julia, you could give me a thumbs up if you can see it, great. There should be an opportunity to vote on how useful or enjoyable you found today's session. So thank you for that. And while you're doing that, I'm just going to talk briefly about next steps. So today what we did is we launched 4 tools which are on our tools page. So feel free at any point to go and download those tools and to share them with colleagues who you think will find them useful. Also, you can email us at hello@haln.org.uk if you have any questions, or there's anything about your anchor experience you'd really like to share with us. We will be reading today's chat in a lot of detail, so thank you to everyone for putting in your reflections and questions, and I hope that you've enjoyed the opportunity to network and meet with other anchors as well. Finally, join the conversation on Twitter, so if anything pops up that you'd like to tag HALN in, feel free to do so. We monitor our Twitter throughout the week. So I think this should mean that you will get approximately 6 minutes back of your day. So I'm going to close the session a few minutes early, and I just want to say a huge thank you to the HALN team, and a huge thank you to the speakers, and a thank you to all of the audience members today. So we'll be emailing out all of those tools that we've discussed, and I wish everyone a great rest of your afternoon.